Joining us now is Dr. Scott Barbour. Dr. Barbour is an orthopedic surgeon, and he does not take insurance. As a result, he keeps his prices low. See, this is how healthcare costs are controlled, not through government mandates, but through getting rid of all the bureaucracy and the middlemen. Dr. Barbour has worked for 12 years at the VA, and he's going to be talking about our government-run healthcare system in the U.S. We welcome him. Dr. Barbour, thanks for being with us here on the John Fredericks Radio Network, sir.
It's a pleasure to be here, John. Thanks so much for having me.
Let's talk about, you're an orthopedic surgeon and you don't take insurance. So if I need surgery and you're my doctor and I have insurance and you don't take insurance, why wouldn't I go to a doctor that had insurance, Dr. Barbour?
Well, that's an excellent question, John. And
Thank you.
The reality is that for the longest time, that used to be the case, that patients would shy away from going to doctors that were fee-for-service and go to doctors that were on their plan. But over the last 10 or 12 years, with the implementation of the Affordable Care Act, which is really the Unaffordable Care Act, and an increase in regulations, the cost and quality of our health care has gotten so poor that it put me in position to be able to offer a better deal to patients. And so we deliver top-level customer service, top-quality care at a price that's less than what a lot of people spend on their deductibles and premiums. And simply by offering a better product, we've been able to get patients willing to come and see us. And for that, what they get is a doctor who's totally committed to the patient. I don't answer to any government bureaucrats or politicians, and I don't have to follow any draconian rules that have nothing to do with the quality of medicine. I simply take care of my patient to the best of my ability.
Can you give us a feel, Dr. Scott Barbour, because we've really covered this, the fact that how prices for care, for medical care, health care, come down astronomically when all the insurance middlemen are taken out. And obviously, whatever you're charging, you run a business, you have employees, you have your time, you've got to make money, obviously, so you got to do it at a profit. So if give me just an average surgery that you might do and what the cost differential is between yourself, no insurance, and the guy or gal up the street, the doctor up the street with insurance in the hospital. Can you give us a feel for what that is?
Yeah, I mean, let me just kind of put this in perspective. I mean,
okay.
First of all, when I was making the decision to go to medical school, I looked into the amount of training, and basically after college, so after I graduated from college, I had to train for another 13 years before I could get to the starting line and begin to practice my craft. I always had in my mind that I wanted to be a self-employed doctor. I wanted to run my own practice and sort of be able to be the one making all of my decisions. And really, one of the leading reasons that I became a doctor was my mom, who was a nurse, really instilled in me the wonderful job that I have being able to take care of people. It's really an amazing thing. When I got out of my training and I started my first practice, I started opening my own practice, and I really had no business acumen whatsoever. And I look back on it, and it's somewhat laughable. And over the last 20 years, I've learned the business of medicine, and what we have here is a complete scam. The government and big medicine are in cahoots. They are making money hand over fist at the expense of the patients. And this has actually been going on for many decades, but for the longest time, it worked, meaning they were making money hand over fist, and we were still getting health care that we tolerated, that we actually, in many cases, we thought was pretty good. And then they just got greedy, and with Obamacare came along, now it is just the doctor and patient decision-making has been completely eliminated. And now, we have this situation where the quality of health care has gotten so poor, access has gotten poor, and we're in a bad state. And it's at this point where I felt like, I need to start explaining to people what's going on so we can start moving in the right direction. But for example, they have it's very complicated. But let's just take MRI for example. The regulations will only allow me to MRI my own patients. I can't buy an MRI and then deliver top quality service and go to my doctor friends around town and say, hey, send patients to my MRI. I'll give you a good deal and I'll take great care of them. That's illegal. And the reason that they do that is because they have these what are called certificate of need laws, which basically prevent people like me from getting a certificate of need voucher to be able to have that type of MRI. Mm-hmm. The hospital systems in the area will block it, and the reason that they do that is so that we drive them to the hospital to get their MRIs, where they charge, $3,500 up to $5,000. When at my MRI, you can get it for hundreds of dollars. Mm-hmm. So there's this constant situation where they put middlemen in the way of doctors and patients and significantly drive up costs. They have these entities that are the middlemen that buy the goods that are needed for healthcare, IV tubing and IV bags and Band-Aids and bandages and all of these things. They purchase them and then they sell them to the hospital with a 70% markup. Mm-hmm. And many of these companies that are these middlemen are actually owned by the hospital systems. So it's really been a downward spiral. As government intrusion into our healthcare system has gotten greater and greater, the doctor-patient voice has gotten less and less. Doctors have quit. People have decided not to go into medicine, and here, 10 years later, we have a situation where we have, in many cases, poorly trained people that are managing our healthcare system in emergency rooms and other places, and patients are starting to see the pain of that.
Really, what you're part of what you're attempting to do here, Dr. Barbour, is you want people to be looking at this in a very different way. So let me ask you something, which is key to this. When your relationship, your actual relationship with your patient under the system that you have, which is getting the middlemen, getting the insurance, getting the hospital, getting the bureaucracy and the corporate entities out. What is the difference between your relationship with your patient and a doctor who's competing with you that's an employee of a hospital? Are you able to define that for us?
Yeah, absolutely. So when you're an employed physician, your fidelity is to your employer. So your employer is going to dictate to you how you practice medicine. For example, there have been regulations that have come down where the government will grade doctors. So one of the metrics that they use to grade doctors is a readmission of a patient within 30 days of discharge from the hospital. Well, if you're a doctor, you realize that there's a lot of reasons that a patient may be readmitted to the hospital within 30 days of discharge that have nothing to do with bad behavior of the patient or poor medical care by the doctor. It's simply the way things work out. But because the government now, these bodies that monitor these things, they take that information and they ding the doctor in terms of their reimbursement if they readmit a patient within 30 days. And so you're basically creating this perverse incentive for a doctor to not allow his patient to be, or her patient to be, readmitted to the hospital within 30 days because it's going to make them look bad and decrease their reimbursement. Mm-hmm. When I'm dealing with a patient, my fidelity is 100% to that patient. And so I get the opportunity to develop a doctor-patient relationship, which is to understand everything about my patient and to counsel them and offer them options about how to treat themselves and how to get better.
This is almost a movement which is going on here, having people understand how dramatically costs come down when we can get the bureaucracy out of it. So I want to get to, we're with Dr. Scott Barbour. He's an orthopedic surgeon. Dr. Barbour, let's get to healthcare, the new plan which has been developed by the Job Creators Network Foundation, which is Healthcare for You. By the way, you can check that out. Go to healthcareforyou.com, not .gov, healthcareforyou.com. I always say .gov because it's eventually going to be adopted in the Trump administration in his second term. Healthcareforyou.com. You've looked at this plan as an alternative to Obamacare, as a kind of different way to go about it. What are some of the things about that plan that you think would revitalize the doctor-patient relationship and bring down healthcare costs in the United States?
Right. Well, first of all, this plan was developed by the Job Creators Network and Physicians for Reform, where we basically got physicians like myself together who have actually been practicing medicine for a long time and really understand, what are the things that will lead to quality health care at the lowest possible price with access for all. And by putting all of this information together, we then did a very exhaustive, the largest market research with 25,000 American voters that included Republicans, Democrats, independents, and people from all walks of life, and developed a framework for reforming healthcare that repairs, restores, and improves the doctor-patient relationship. Mm-hmm. And by talking to these patients and doing very in-depth analysis, what we found is people want a personalized healthcare plan, and they want a plan that's tailored to their specific needs so that they only pay for the care that they get. They don't want this one-size-fits-all government plan like Medicare for all. And so the reason that we have to put this framework together, it's always laughable to me that politicians come out with our health care plan as if you can write down on a piece of paper the list of things that are necessary to implement a plan. It's a very complicated situation, and there are problems with regulation at both the state and local level that are causing problems. And so within this framework, some of the things that we need to do, number one, patients need to own their own health insurance. We need to get away from this third-party system and getting your insurance through your job. Mm-hmm. This is going to help with portability so that when you leave your job, your health insurance comes with you because you own it. We also need to do things like create access to direct medical care and get these middlemen out of the way. We need to allow patients to keep personal health accounts with pre-tax dollars that they can then use for direct access to direct primary care and also put towards specialty care. And we've already seen direct primary care is exploding in this country, and it's already showing us that it's a 40% decrease than traditional insurance rates. We also need to restore competition among insurance companies. I mean, why is it that Geico and Progressive and these other health insurance or these other insurance companies are not allowed to provide insurance plans? I mean, they have a client base, they have actuaries, and the reason is there are regulations, both at the federal and state regulations, that prevent this competition, and that allows the few players that we know, right, the Blue Cross Blue Shields, the Uniteds, the Humanas, to have an oligopoly in this scenario, and that allows them to keep their prices high. We need to take advantage of modern technology. For example, I have 5 clinics in the Atlanta area and a surgery center, and I have employed technology with Skype and FaceTime so that I can be in multiple places all the time. So today is an operating day for me. I'm going to be doing 10 cases in my surgery center, but I'm going to be in contact with the other providers in my practice, talking to patients, going over MRI, and putting a plan together that helps move my patients' care along. The number one thing we need to do is protect against pre-existing condition. Look, this has been a big problem with healthcare for a long time, and the reality is the amount of people that actually have these pre-existing problems are relatively small. Mm-hmm. And we'd be better off just paying for their care and getting them out of the insurance market.
Right.
And there are a number of ways to do this. You can just have the various insurance companies pay a small premium that goes to covering the cost of people with these type of chronic care issues like diabetes and things of that nature. There are actually a number of ways to manage that, and I believe we should leave it to the states to decide. Every state is different and has different obstacles, and they should be able to tailor their program so that it gives the best possible care to the people who live in that state. And then we also need to lower drug prices. And right now, drug companies will offer rebates for medications, and these rebates go to middlemen and never make it back to the patients. And this dramatically increases the cost for drugs, and we need to make sure that those rebates and savings are returned to the patients and not these middlemen. The other thing, too, is we have more than enough data to understand what's going on here, meaning one-size-fits-all government-run healthcare is draconian. It doesn't deliver care. It's extremely expensive, and the quality is abysmal. And in our own country, we need to look no further than the VA for total government control. That is an example of total government control, and what you see is absolutely no access, massive waiting lines, and basically zero quality. And when I was going through my training in medical school and in residency, as students, we used to laugh about the care at the VA. And whenever you were doing a rotation at the VA, people would say, "Oh, you're on vacation," because nobody does any work there and nothing gets done. And it's a travesty. My father is buried in Arlington National Cemetery with full military honors, and he's a military guy. And it disgusts me that this is how we treat our veterans, and there's no reason for it.
Unbelievable. It's what you've outlined here is really groundbreaking stuff. That's why we're such supporters of the Elaine Parker Job Creators Network Foundation plan that was developed with doctors and patients. More information, go to healthcareforyou.com, healthcareforyou.com. Dr. Barbour, I'm out of time. I really want to thank you for being with us today.